Chapter 4, what it does is say, all right, we've got all these problems about longevity, what are we going to do about it? So it looks at what solutions can policymakers provide. And as I say, we'll just go through these very quickly. The obvious one is indexing eligibility age with life expectancy, but as Sam has pointed out, that this has various problems when you look at subgroups and when you look at people who aren't fit enough to continue working to the higher eligibility age. You can increase early retirement penalties and reward delayed retirement, but one has to be very careful there because these changes are made on broad actuarial principles and individuals' utility might be quite different. You can strengthen the eligibility requirements other than raising the age, for example, increasing the length of period at which people have to contribute to be eligible for benefits. You can provide an eligibility age that differs by population segments. For example, people in emergency services, in hazardous occupations, you can provide different eligibility ages. You can introduce policies that combine work and retirement so that instead of people having to forego their pension while they continue working, you enable them to take the pension as well as working. And what nearly all developed countries do is encourage higher pension payments from employer-sponsored plans through the tax systems so that some of the financial stress on social security programs is taken away. Subsidising certain population segments means that providing higher benefits per contribution for people of the lower socio-economic groups. Linking eligibility age for pension with eligibility for other benefits. The example there is in the United States where people can be eligible for benefits at age 62, but Medicare doesn't come in till age 65. So there is an incentive to work longer. And as previously mentioned, harmonising the eligibility age of employer-sponsored plans is important. You don't want leakage from the system. You don't want benefits being paid out in advance of people retiring and going on social security. Finally, increasing labour force participation rates and employment rates for older members. There are in most countries already bans on age discrimination, but it has to go much further than that. There has to be positive encouragement for people to continue working. In Chapter 5, what we look at is the effects, both positive and negative, of different eligibility ages on employer-sponsored plans and their participants, on social security programs and on the economy. Defined benefit plans. Most of these were set up many years ago in far more favourable economic and demographic circumstances. Affordability and sustainability are the key concepts in setting eligibility age, and the employers, have to look at increasing it as one means of keeping the funds sustainable. Defined contribution plans, which are now growing increasingly important, it actually comes down more to an individual choice, and previous speakers have talked about some of the factors, but really from an employer's point of view, there's a simple contribution rate that is paid that doesn't vary. It's really up to the individual to determine when he or she leaves. One bright spot on all this, with all the challenges of increasing costs, is that when you increase the eligibility age, or when you increase the age at which people retire, you get an additional period over which contributions are paid. You get an additional year of contributions, and you reduce by a year the period over which the benefits have to be paid. And what that means, I won't go into the background now, but essentially, if longevity increases by X years, you do not, in theory, need to increase the retirement age by X. It's less than X because of the combination of the three factors. Another point that we make is that, as you mentioned right at the start, there is definitely a trend towards part-time work. There's a trend to more portability. There's a trend to more flexible working patterns. We make the point that defined benefit plans, defined contribution plans are much better placed to cope with these changing work patterns. We don't want to start an argument of whether defined benefit plans or defined contribution plans are better. That could take all day. But in this particular aspect, defined contribution plans do have an advantage. Another aspect we looked at is if you increase the eligibility age, then everything else being equal, you're going to have more funds under management. And the question arises, is there enough opportunities for investment in a world that is already awash with liquidity? The conclusion we come to is yes, there will be opportunities, and in fact, as populations age, there is a need for greater investment as productivity will need to increase if we want to maintain our standard of living. We do look at the effect of increasing the eligibility age on social security, but I won't go over that because the other speakers have talked about it. The point I would like to make, though, is increasing the eligibility age does increase the incidence of disability, ill health and unemployment amongst workers, so that you don't get as much as a savings as you might anticipate. And another point I'd like to emphasise is we know that higher socio-economic groups, or members of them, have higher longevity, and in fact there is evidence that this gap between the higher and lower groups is increasing. So you have the rather strange situation that higher socio-economic groups to a certain extent are increasing the longevity, leading to an increase in eligibility age, whereas people in those groups don't have as much need for social security. They are able to work longer generally, and they have the resources to retire if they want to. And of course the reverse applies to the lower socio-economic groups. So there is a very serious issue there of just automatically driving up the eligibility age with increase in longevity. From the Australian experience, we looked at, or a study looked at increase in expenditure over, through to 2060. One of the interesting things is this is increase in expenditure caused by changing demographics. The total effect is 6.9% increase in GDP, but of that only, in inverted commas, 1% is the age pension. In other words, health and aged care, etc., is likely to have a greater effect. And this study also looked at the effect of increasing eligibility age from 67 to 70 and came up with a relatively small saving of 0.15% of GDP after allowing for increased costs of disability and unemployment benefits. One beneficial effect of increasing the eligibility age is that for many people working longer is good for their health and satisfaction, and as mentioned before, there's no evidence that increasing the eligibility age increases youth unemployment. In fact, quite the contrary. There's positive correlation between employment at the older and the younger ages. And finally, a word from our sponsor, the International Actuarial Association. Actuaries can and should be heavily involved in all aspects of programs, but it is not necessarily the case. I mean, we have in the UK and the US and Canada fantastic examples of actuaries involved in social security, but in Australia and I believe in Germany, many developing countries, it's just not the case. Actuaries are heavily involved in pension plan advice to sponsors, and speaking from Australia, where we've kind of led the way to defined contribution plans, there is increasing opportunities for actuaries being involved in assisting members to meet their retirement objectives in a defined contribution environment. And finally, as we say there's a need for actuaries to combine a macroeconomic view with micro-analyses to develop practical solutions and promote the use of reasonable assumptions and models to form the basis of policy decisions. Or in other words, as actuaries, we can't just be technocrats, we've got to be all-rounded, trusted advisors and give holistic solutions to help our clients. Thank you.